This is Dr. Bert Stevens with SOAR Physical Therapy, reviewing the GenuEase device by TherapEase. Restoring functional knee range of motion just got easier. Patients regain full knee range of motion in weeks, not months. Reduced muscle guarding allows faster improvement in knee joint mobility. This device allows stretching in both flexion and extension directions. We're here to demonstrate a GenuBend machine by TherapEase. This is a device designed to help knee range of motion restoration and help avoid some problems and complications with arthrofibrosis and knee range of motion limitations post-surgically, especially following total knee replacement. We're going to show you how this device works and explain some of the advantages and the features of the machine here. It's easy to get into. It's very comfortable for the patient once they're sitting up here. There's some stabilization straps and belts, one across the pelvis and to stabilize the hip area, one across the thigh, and another one down at the ankle joint area above the foot. The machine's operated using a little crank mechanism here. It's very low energy needed by the patient, and it's just kind of a slow, controlled motion as they can help bring their knee. And one good thing about this machine is it does both extension and flexion directions. But you can see it going up into an extension stretch here, and then the patient can hold it for a prescribed period of time, and then simply alternating direction on the crank, they can slowly bring their knee back into a flexion stretch. You can see it goes into quite a bit of flexion on the machine here. It goes quite a bit underneath the table, and if they're getting that amount of motion then they're doing very well after the knee replacements. Okay. An interesting or a good feature on the machine here is it has feedback for the patient. Several things that it shows on this screen is an approximate joint angle. Right now it's showing me at 120 degrees flexion. You can see it's fairly close. It's not going to be an exact measure like your goniometer measures, but it's good feedback. You'll see in a second. It's got my total time I've been on the machine, and it's counting down, and also hold time on the stretch that I'm actually in. So once I change direction, you'll see it'll hold, time will be reset, the total time keeps going, and the angle changes according to the measure I'm going. And you can bring it all the way up into an extension, and after a brief pause it'll reset and the counting time will be held and count over again. So often it's beneficial for a prolonged stretch, at least a 20 to 30 second hold time in the angle into both flexion or extension stretching, and then you can alternate positions, or if they're only limited in one direction, you can just go into that direction with a hold or a rest time between it, not necessarily alternating flexion and extension stretches.